Hi, everyone. You could be with us, and as we talk about APD or auditory processing disorder, I am delighted to have our co-speaker with us today, Ms. Sarah Darwish, who will be presenting herself in a bit. This webinar has been organized by HOPE, Habilitation Medical Center, and I am happy to share in this webinar today as part of their team. My name is Sandy Nune, and I am a speech therapist here at HOPE in Dubai. I have been working in speech therapy for nearly 7 years, during which a vast amount of my experience covered working with children, so babies, toddlers, preschool and school-aged children, and adolescents with various profiles. I have especially worked with individuals with communication disorders stemming from autism or other developmental disorders, and working with language disorder, literacy disorders, articulation, such as articulation speech, and language, and swallowing and stuttering disorders. I will pass on the mic now to Ms. Sarah, who will also be introducing herself to us.
Thanks, Sandy. I hope you can all hear me. Hello, everyone. I'm Sarah, and I'm coming to you today from Advanced Hearing and Balance Centre. I've been here in the UAE for many years and in the field of audiology for going on 17 years now. So what I do is I'm involved in the assessment of hearing and balance in children and adults. I also work closely with some children and schools in assessing for hearing loss and for auditory processing, and I also work with hearing aids, so I can help people to restore their hearing using some really fantastic devices available on the market today. I'll be here to talk to you today about auditory processing, and hopefully at the end of this session you'll feel much more informed about what exactly auditory processing is. So shall we start? Yep. Okay, so first we wanted to give you a little bit of an introduction about what is auditory processing disorder. So it's very different to hearing and hearing loss. So auditory processing is a deficit in somebody's ability to process and comprehend sounds. And in the broadest sense, it is how the brain uses auditory information. It's a problem in listening for language learning, and it affects around 7% of children. It often starts in childhood and can extend through to adulthood, and it's usually due to an interruption in the building blocks of language learning, and that can happen through ear infection or genetic conditions, through serious illness and some neurological disorders as well. It's really important to highlight that auditory processing is not a hearing problem, and that usually auditory processing impacts those who have normal hearing, and they have difficulty processing the information once it is heard. So usually what we would do is we would collect information about the patient, and during that process of assessment, we would ensure that the patient has normal hearing before we start to explore auditory processing. So auditory processing presents in many different ways, and there can be numerous signs and symptoms, from a mild to severe degree, and everybody is different, and it presents quite differently across individuals. And it can be inconsistent as well. So because the individuals have normal hearing, they would possibly present as quite a normal hearing and normal auditory processing able person in a quiet situation, such as when they're at home or in a one-to-one situation. However, in a noisy, dynamic environment, such as in a classroom, they would be quite different and display different behaviours in those situations. So there could be reports of a completely different child in a classroom versus what we see at home. So auditory processing and hearing loss, as I said, they're very different. They people with auditory processing have normal hearing. And so, but just to highlight what hearing loss is in comparison. So if we were to say, consider that the ear or the hearing system is not working, it would be similar if we compare the hearing sense to our other senses, such as vision or smell or taste. And so a hearing loss would be similar to loss of vision or a loss of the other senses. And so this is very different to auditory processing, as I said before, because the hearing sense in somebody with auditory processing deficits is actually normal. So what we would do is to first define that somebody has normal hearing, and to do that we would do a hearing test. And a hearing test looks a little bit different across the age groups. So for young babies, we would be using machines to determine the hearing is normal by sending sound into the ear and then waiting for a response to come back. And in older children, we would do behavioural tests such as listening and looking for sound, or listening and responding by waving their hand or clapping their hands or pressing a button. And we would do that at a series of ages. So we would definitely be doing a hearing test at birth and a hearing test in toddlerhood, and then a series of tests through school as well. And so once we've determined that somebody has normal hearing, and if we find or identify that there are signs and symptoms of listening trouble, even though there's normal hearing, then we might start to consider that this person may have an auditory processing difficulty. So it usually happens that we would run these assessments and checklists around the age of 6 or 7 as a minimum. So once we've identified, as I said, the patient has normal hearing, if they have the signs and symptoms, and if they're as a minimum 6 to 7 years old, then we would start to consider an assessment for auditory processing. And lastly, I guess the question remains, what would an auditory processing assessment look like? If we've already tested the hearing, what more is there to do? And the difference between a regular hearing test and an auditory processing test is in the type of stimulus we use. So for an auditory processing test, we would do things like playing a speech, such as words and sentences, in background noise, and we would determine whether the individual had difficulty with that. We would also ask them to identify if they can hear the finite differences between particular speech sounds or words. We would also ask them to listen out for competing information, so listening to a sentence on one side versus a competing sentence on the other, and ask them to separate or differentiate the two. And we would also ask them to fill in missing pieces. So if there's part of a sound missing or a word missing, we would ask them to fill in the gaps and draw on their knowledge of their language to be able to fill in the missing pieces. We might also do some memory tests, some problem solving and concentration tests as well. So over to you, Sandy.
Okay, thank you, Sarah. So I want to touch on the definition again, but I want to focus here on its connection or correlation with other disorders. Because the term auditory processing often is used very loosely by individuals in many different settings to mean many different things. And the label APD, or auditory processing disorder, has been applied often incorrectly to a wide variety of difficulties and disorders. So in its broadest sense, as Sarah has already mentioned, APD refers to how the central nervous system uses auditory information. So the central nervous system is vast, and it's also responsible for functions such as memory, attention, and language. And this is why Sarah also mentioned that these are functions that are tested to further refine our diagnosis. So to avoid confusing APD with other disorders that can affect a person's ability to attend, understand, and remember, it is important to emphasize that APD is an auditory deficit that is not the result of other higher order cognitive, language, or related disorder. So there are many disorders that can affect a person's ability to understand auditory information. And for example, individuals with attention deficit or attention deficit hyperactivity disorder, ADHD, may also seem as poor listeners and have difficulty understanding or remembering verbal information. But their actual neural processing of auditory input in the central nervous system is intact. And when you're observing a child or an individual with ADHD, there are also other markers that could help you recognize the two apart. Instead, it is the attention deficit in ADHD that is impeding their ability to access or use the auditory information. So it's not the auditory processing skill itself that presents with a deficit. Also, I want to talk about autism. So children with autism may have great difficulty with spoken language as well and understanding spoken language. So there are some common signs there. But in autism, we're mostly talking about a higher order global deficit. And there are plenty of other signs observed with that as well that can cause these difficulties. So it's not a specific auditory dysfunction. And we also talk about common signs between language processing and auditory processing, which are very often used together, but they are different. So to re-mention what Sarah has already said, it's an auditory deficit, and we need to keep that in mind. And why am I mentioning this? I know it's a little bit of theory, but it's very important to know that for parents and teachers, because we've seen so much in our clinical experience, teachers and parents who come up to us and who already come with a diagnosis in their pocket and a label in their pocket. And they come here sometimes expecting us to just confirm the diagnosis they have in mind, that they heard one teacher say to them or they've read about online. And that's usually very overwhelming for parents. And it's also not helpful for the child. And so when we talk about that, it's to spread awareness that, okay, there are disorders over in the world that share common signs. And we should always seek professional help or consult experts in the field that are able to do an accurate diagnosis and to specify what the needs are and what the disorder is so that an individualized treatment plan can be elaborated and created. We don't want to increase these misconceptions, but we want to help decrease them. We want to spread awareness because every child is different and their need is different. And it's very important to detect these needs specifically to what the child is presenting with so that we can treat accurately and we can provide the right support, whether as professionals or as parents and social surrounding. And to talk now about the signs of auditory processing disorder, also Sarah already said that APD is an umbrella term and it describes various subtypes that affect how the brain perceives and processes what the ear hears. So because of the different types, there are also different symptoms, and these symptoms can vary from one child to another. So no two people with APD are actually alike, and they have different challenges, various challenges with everyday listening. And so I'm also going to touch again on what Sarah said. Sometimes children with APD can have what seems like typical auditory behavior at home, but when you put them in a noisy environment, this is where you begin to observe these signs more clearly. So let's talk about these common symptoms of APD. We notice frequently requesting repetition and or rephrasing of information. So these individuals are often saying what or huh, asking for a repetition of the question or for you to just reformulate the information. They have difficulty understanding speech with competing talkers or background noise. And I'm reminded of a classroom setting in this case. So just imagine in the classroom setting when there's a lot of instruction going on and the teacher is sharing really important information for the student to know, and there's this background noise, how that could impact literacy and it could impact learning experience. So this is why, again, this is a red flag that we need to keep an eye on so that we can help detect these signs as early as possible. They have difficulty following multi-step or lengthy oral instructions. Because there's a lot of verbal information in long instructions, it's important to put ourselves in the child's shoes and just understand how it's hard for them to capture every linguistic information there is in this instruction. Mishearing auditory information, slowness in processing and responding to auditory information, and but not often responding to their name, depending on the setting they're in, depending on where they are, or responding to even simple instructions that they can probably understand. Slowness in processing and responding, the next one would be distracted by background noise, often sensitive to soft sounds in the environment most people do not notice. They get overwhelmed by complex or noisy auditory environments like classroom, parties, shopping malls. They have difficulty maintaining attention when listening to verbal information. There is inconsistent or inappropriate responses to spoken requests, misinterpretation of questions, difficulty remembering spoken information. And so you see how even memory and attention can seem dysfunctional. And this is why these signs cannot be diagnosed by a non-professional or someone who's not expert in the field. And it's crucial in the midst of these signs that we consult an audiologist so that we can discern what these signs are and what they come under, and so that we can elaborate the right help that the child needs. Because we do observe these signs in other disorders and other difficulties. So a multidisciplinary team approach is usually very critical, although it's the audiologist that confirms the diagnosis, and it should be an expert audiologist, and I think Sarah will talk more about that in a bit. But a multidisciplinary team usually does the full assessment to understand the cluster of problems exhibited by children with APD, and a teacher or educational diagnostician may shed light on academic difficulties. A psychologist may evaluate cognitive functioning in a variety of different areas, and a speech and language therapist may provide investigation on written and oral language, speech and related capabilities, and so forth. So it's very important to just highlight this information over and over again, is that if you're suspecting challenges with processing auditory information, don't just leave it out there. Do what's best for the child. And so to prevent further development and further severity of the signs, consult with a team so that you can just provide the necessary support and facilitations that your child might need. I will lastly touch on the treatment of APD, and I will not delay on this point, but rather to mention very superficially what the treatment elements or the main components of treatment are. So when we want to help someone with auditory processing disorder, because the main deficit is in auditory processing, the primary areas that treatment of APD focuses on is one, changing the learning or communication environment. And so this is why it's important to collaborate with teachers and to communicate with these teachers so as to implement the necessary support in the classroom setting. And sometimes this could lead to a change of classroom or to installment of assistive technology that Sarah knows more about and could mention more about, so that the learning experience may become optimal. And we also recruit higher order skills to help compensate for the disorder. So in case we don't have comorbidities and we have a specific auditory processing disorder, we want to use the skills, the strength that the child presents with to work on the weaknesses that he has. And finally, we obviously want to remediate the auditory deficit itself, which is working on the foundational auditory skills, listening skills, auditory perception in different settings and situations, and auditory discrimination, even working on memory and auditory memory and attention. So yeah, that's why it's very important to act and not to leave these observations behind. Sarah, I'll pass it to you now.
Thank you. So I think, yeah, so you mentioned about like using some personal amplification devices. This is a definitely an area where I can help. So sometimes, occasionally, if we find a severe case or a case that needs extra support, in say a child who's having difficulty maintaining attention or hearing the teacher in the classroom because of all of the background noise, we may recommend a personal amplification system. So we would fit that to the child. It's an ear level device, so it's a little bit like a set of headphones or a little device over the ear, and then the teacher wears a microphone, so they have a direct connection to the teacher and direct input of the teacher's voice into their ears. So that's really handy. It increases the loudness of the teacher's voice and it helps the child maintain better attention and gives them a really strong signal in those environments. I obviously totally agree with acting as sooner rather than later, and early intervention is critical. I see a question on the side from Lama about how early it can be diagnosed. So usually you'll find many resources will recommend a diagnosis would not be able to be made at least below the age of 7. So around 7 years old and above, we can begin to assess all of the skills of auditory processing. And this is necessary because we cannot simply diagnose auditory processing by a simple hearing test. So the tests that we use are standardized, which means that they have data and statistical norms which are collected based on a population. And with that data, we compare the child that we're testing to that those normative values. So that's critical in testing somebody with auditory processing with those tests, because we need to be able to compare their response to a normal population. And so around age 7 as a general guide. We do have the option of using some informal apps that I have available as well, but they don't really lead us to a formal diagnosis before the age of 7. We would just merely have an indication of skills, and it would be able to guide us toward intervening before the age of 7, but no official diagnosis could be made before then, that's for sure. I think that the most critical factor is that intervening early is going to give the child the better chance at remediating their difficulties. And because of the deficits that they experience, it can have a knock-on effect to their literacy and language. So of course, if we're struggling with our literacy and language, we can suffer academically. So to be able to intervene with auditory processing as early as possible is going to get the children on the right path, and managing their difficulties as early as possible is key.
Can I just add, Sarah, that this is a very key principle in our interventions in all types of disorders, not just APD. Early detection and early intervention has been proven over the past recent years how effective it can be in providing the right support, the right treatment for the child, and preventing preventing signs from becoming more severe and more grave. So what we often tell parents is that, okay, parents do seek a diagnosis and it's their right, and obviously we should go towards that, finding the right diagnosis so as to specify our treatment plan and make our interventions more effective and more individualized. But sometimes, just like in the case of APD, because it takes longer to confirm the diagnosis, which is usually at the age of 6, 7, or 8, it doesn't mean we have to wait this long, just like Sarah said, because we want to focus on what the child has and how he is different from his peers in functional skills, in skills that he needs in his daily life, so as to be able to function in the different situations and settings that he is in. So, as brain maturation develops, diagnosis will become more clear, but the need starts from a very young age, and all we but to answer your other question, Mama, is can I please know if APD causes speech delay? Well, I'll go from what we talked about. So APD, auditory processing. I'll focus on the first word, auditory. So language, if we are talking about oral language, is very auditory. Everything the words you are using right now, the words that we use to communicate with one another, we learn via auditory canals and auditory skills. So we need these, I wouldn't say prerequisites, I would call them parameters, foundationals, but they are prerequisites so that we can be, they are actually prerequisites so that we can be able to develop our speech and language skills um, as normally or typically as we should. And so when you have difficulties with hearing information and understanding speech with competing talkers and following multiple step oral instructions, as we've already said, or mishearing auditory information, this can definitely have an impact on speech and language development. Okay, and it could lead to a detection of a delay compared to his peers. And you'll notice difficulties, as we said, with listening, responding to his name, reacting to their name, reacting to surrounding noise, reacting to verbal noise. That could be simply a simple instruction that we're saying, and building up vocabulary. Save these words in my mind. And so, yes, so not to expand the answer any further, I'd be more than ready to discuss it more, but we want to be careful with speech and language delays and APD. It's definitely a necessity to consult a speech therapist when we have suspicions of APD. Yeah. Oh, Sarah, you're on mute.
There we go. So I just wanted to extend on Lama's question about APD and speech delay. So if we're concerned about speech delay in the early years, so in that critical window of 0 to 3, if there's a speech delay there, then a hearing test is definitely recommended. So any time before the age of 7, we should be really sure that hearing is at optimal levels. To ensure that there are no causative issues with hearing to create speech and language problems.
And it's part of our protocol in any speech and language intervention when we're collecting data from parents. We always ask them, did you do a hearing test? Whether they're coming in here for communication difficulties or speech and language difficulties. That's how much hearing is important. So we're always collaborating with audiologists on that.
Yep, it's
Yeah.
absolutely. I mean, it's the way speech and language is formed is through the hearing sense. So you can't have one without the other. And yeah, hearing is obviously it should be tested at birth. It isn't always. Sometimes some children slip through the cracks. It should always be assessed at birth, and then it should be regular for hearing screenings. In fact, the World Health Organization recommends that children do one at birth, and then at 2 to 2.5 years of age, and then throughout their schooling in years 1, 2, 3, 7, and 11, believe it or not. So this is a World Health Organization recommendation. So auditory processing aside, we should always be sure that we're on top of our hearing as well, because temporary conditions can come and go and impact our hearing from time to time. And in those moments where our hearing is impacted, we're actually causing a knock-on effect to our auditory processing development and our speech and language development. So it's all connected.
Yeah, it is.
Yeah.
Well, thank you, Sarah, for joining us today. I think we took so much precious time and precious information. And I will stay a little bit longer just to answer the last question that is more relevant to autism. But thank you for being with us, and go speaking.
Thank you so much, everyone. Have a great day. Thanks, Sandy.
Bye. So I have a question from Burke. What are the prerequisite skills for speech and language therapy for children with autism? This is a good question. It's an important question, but I will kind of reformulate the question into when should I see a speech and language therapist? Well, first, if you do already have a diagnosis of autism, this is definitely a prerequisite. This is definitely when you want to see a speech and language therapist. They are the main professionals who intervene in speech and with children with autism, because when you talk about autism, you're mainly talking about communication and you're talking about social interaction. And so it's up to the speech and language therapist to work on that in using the right evidence-based approaches so that we can help the child develop communication in various settings, in the clinical setting and the home and the school and the social environmental setting. But if you are suspecting that your child might have autism, if this is your question, then you really want to keep a look on communication skills and also language, because we can and we very often see language disruptions when a child presents with communication deficits or social communication deficits. And when you talk about social communication, you're also talking about nonverbal communication. And under nonverbal communication, you're talking about the way the child is making eye contact. But that is not the only sign, because usually parents focus on this point alone. Making eye contact with others for enough time, interacting with others. So these children, do you notice isolation or putting a distance with people, or going away, keeping a distance and just getting away from main social partners, or breaking these moments of social interactions very easily and very quickly. There are short to little to no moments of social exchange. He doesn't or she doesn't play with others. They don't make friendships easily. They can't approach kids their age easily. You notice difficulties with expressing emotions and understanding emotions. And expressing emotions can be through facial expressions. So you usually notice very little diversity of facial expressions and expressing emotions via the body, with the body. So there is no interacting with hugs or interacting. It's not that the child doesn't hang on to you, but you want to be careful of what they're doing. So a social hug, they're approaching you with their arms wide open to give you an actual social hug. And it's not holding on to you very tightly, because sometimes this means that they're looking for a sensory reassurance or sensory stimulation. You want to keep an eye also on the use of gestures and signs. How often do they use conventional gestures such as hi and bye to interact with others? And the proximity. Proximity means the social distance that two people have with one another when they're interacting with one another. Do you often notice dysfunctions in this social distance? Are they too close, or are they always far, moving around, very far from interacting with you? And how often do they approach you to play with you, to enjoy pleasurable moments of interaction? Or are they just using the parent as an object to get to what they want? When they need something, they might grab your hand to get to to an object or a desired toy. Also, in language, you might notice lack or little use of language to communicate with others. Even if their language is developed and you do hear sentences, often these sentences may appear like plated sentences, or sentences that are repeated with the same melody, the same tone as they were heard, and they are not used to communicate with others. But because parents can observe these signs but tend to either overdiagnose or underdiagnose, it's always the main thing to do whenever you're suspecting differences in communication and language compared to children their age, compared to their peers. You want to consult a speech and language therapist just for early detection and for prevention and for installment of the right intervention. So I hope to have answered your question. I don't know if there's time for other questions. You're welcome. So I want to say thank you again to all who were able to attend today. I hope this topic was presented in a clear and thorough manner. You can, for any inquiries or concerns about your child's development, we are always happy to help and provide the right information. Thank you all for joining, and hope to see you in another webinar. Bye.